Senator Kennedy, thanks for appearing. I think Senator Sanders makes a great point on obesity and type 2 diabetes. And, you know, replacing ads or warning people that food is bad would be one thing. But one thing we could do immediately would be having the taxpayer quit subsidizing bad food. So soda infused with sugar, chips, dips, Twinkies, ding-dongs, donuts, bags of candy. We should agree, and I can't understand, I've had this bill for a couple of years, we need to get somebody across the aisle that cares about nutrition enough to say we shouldn't subsidize bad things. And one thing I think you have done is actually directed the states and given states waivers to try to do this, but we need to codify that. And I won't ask you a question on this, I just hope that the administration will think about supporting the bill and letting other Republicans know that you will support it if it comes through. My question is this, though, because I think there's agreement to a lot of problems, but we disagree on solutions. We agree with the problem of high drug prices. It's a problem. Some people, really on both sides, say, well, if we just publish the price, the problem will go away. I'm one who doesn't believe that at all, because I think most prices are fixed, and most consumers really don't care about the prices, why the prices are high. Now, why don't they care about the price? Because they don't pay it. You know, it's either fixed through their insurance company, it's fixed through Medicare, it's fixed through Medicaid. Almost all the prices are fixed. The only people who actually pay the price of the drugs and care about the price of drugs are people who have a high deductible and have an HSA. So there are a couple things we could do that would transform the drug pricing world and the insurance world that cost nothing to the taxpayer. Only about 10% of people have an HSA. Why? Because the government rules say your insurance product is not eligible for an HSA. I'd make everybody eligible for an HSA. I'd let your health savings account pay for your premium and your deductible. I'd let your HSA pay for healthy things, gym membership, diet program, all kinds of stuff that could be for better health. Let everybody have an HSA, raise the limits. I would also let people negotiate. What happens is if I go to the store and want to negotiate over the price, nobody cares. But if I joined a co-op like Costco or Amazon through an association health plan, they could bid for my insurance. Costco has 44 million members. You think they're going to have more leverage than me and my 5 employees? So in the first Trump administration, President Trump did an executive order on this. We have legislation to do this, and we're talking to people in the administration, but we'd appreciate help on letting people join a co-op or an association plan regardless of their employment. Right now it has to be, you have to all be carpenters, you have to all be farmers or cattlemen. We think anybody that belongs to Costco or Amazon, let them be a purchaser of insurance by loosening up the laws, and that would work. So I'd appreciate your idea on legalizing, increasing HSAs, and then legalizing the concept of letting people buy insurance or drugs through like a large co-op across state lines.
And wouldn't it be great if we took the billions of dollars that we're giving to the insurance industry, which increased its share value by 1,000% after the passage of Obamacare? Wouldn't it be better if we took that money and gave it to people to buy their own HSAs, which gives them value-based care, and then let them actually participate in a market that will drive down prices?
The only reason I would differ on that, because I'm not sure how you're talking about taking the money from the insurance companies, but I'd be for the idea that the insurance companies would get less of the take if we expanded HSAs and you were negotiating directly.
It's another way to put it, Senator.
Well, and then the money would be more directed towards the individual, and the individual would be able to use it. The other thing about it that people don't think through is they say only rich people have HSAs. Well, let's say only 10 or 20% of the people have HSAs. Because they bid on the prices, it brings down the price for everybody. And when you have innovations in the marketplace, rich people do get them before the rest of us get them. But it always drives the price down as it spreads to the rest of the marketplace. But I think there are things we could do and would be open to. And the thing on restricting bad foods from being subsidized, and then the idea of negotiating as a co-op, neither one of these costs money or even saves money, but ultimately would give a lot more power to the consumer.
I would just add that 50% of the states have now, at our request, applied for waivers so that they can get soda and candies off of SNAP. We're paying for the poorest kids, 63 million poorest kids in this country, to get diabetes, and then we're treating 78% of them with Medicaid afterwards. So we're paying at both ends. It makes no sense. And once we finalize the ultra-processed food definition, we can ask the states to start adding that to their SNAP waivers.
I agree completely, and I think if you did that, and if we did that across the United States, it could be the most important thing we do for the health of Americans, and particularly for poor kids, that we've ever done in our history. We have to get beyond this, oh, everybody has a right to a bag of candy. No, we need to have healthy foods. There's lots of other food that you can buy, but we should restrict it from the unhealthy things, and I appreciate your efforts on this.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.